So I'm Laura Castillejos. I'm a nurse. I'm from Barcelona, Spain. And the last 10 years I've been working as a nurse in intensive care units. And also I was teaching at the University of Barcelona. And in this video, I'm going to talk about palliative care. The lesson goals for this video are to know more about what the goal of palliative care nursing, aspects of care, pain and symptoms management, and patient safety culture. So now we are going to talk about what is the goal of palliative care. So the goal of palliative care is to prevent and relieve suffering and to support the best possible quality of life for patients and their families, regardless of the stage of the disease or the need for the other therapies. What is palliative care? Palliative care is comprehensive treatment of the discomfort, symptoms, and stress of serious illness. Palliative care works together with the primary treatment, and the goal is to prevent and ease suffering and improve the quality of life of the patients. When we talk about the end of life, or about people who need any care because they are ill, we have two different concepts, and that's important to know the differences between them. So palliative care is different from hospice care. Palliative care is available anytime during the illness. Patients can receive palliative care at the same time they receive other treatments for the illness. And the goal is to make the patient as comfortable as possible and improve their quality of life. People in hospice always receive palliative care. And hospice focus on a person's final months of life. And to qualify for some hospice programs, patients must no longer be receiving treatments to cure their illness. A nurse may choose to specialize in palliative care. So, what is palliative care nursing? For nurses, human response is a complex phenomenon that involves the physical, social, emotional, and spiritual aspects of being. And palliative care nurses involves the assessment, diagnosis, the treatment of human responses to actual or potentially life-limiting illness and necessitates a dynamic caring relationship with the patient and family to reduce finally all the suffering. So therefore, palliative nursing is a specialty of nursing practice that continues to evolve as the art and science of nursing and palliative care evolves. Palliative care nursing demands intense critical thinking, heightened levels of mental functioning, and the ability to use complex palliative skills. Where is palliative care provided? Palliative care can be provided in the hospitals, at outpatient clinics, or at home. And there are some skills very important to learn and understand that help a lot during the palliative care nursing. We have 3 skills. I'm going to talk about 3 skills: communication, compassion, and human vulnerability. About communication, the ability to effectively communicate with patients and families is an important, very important skill for any palliative care nurse. Palliative care nurses must have the ability to explain complex information, as patients are often seeking clarity on disease progression, medications, and plan of care. And palliative nurses must be able to communicate this information to both patient and family. It is within the nursing sphere of practice to thoroughly explain and educate patients and families on symptoms and treatments through the end of life, including medication regimens. About compassion, I was looking a lot about for the concept of compassion, and I want to share it with you one definition I found in Thursday. Compassion is a sympathetic consciousness of others. This stress together with a desire to alleviate compassion for self can help to prevent burnout, while compassion for patients and children helps to establish a supportive, trusting relationship as symptoms change or worsen or as death approaches. About vulnerability, although the time of ongoing disease progression and at the end of life can be distressful, it can also be a time for togetherness for patients and their loved ones. The palliative care nurse has a window into some of the most intimate moments in a person's life. And patients and families tend to remember the nursing response to their needs, and which through communication, just presence and symptom management and other work within the multidisciplinary team. And that allows nurses to leave a legacy through care. And that's, I think it's really, really important in this area. So as you can see here, there are a lot of aspects of care in these sections, and there are different professionals involved in care. Afterwards and during the rest of the presentation, I will focus more on the pain management of these patients, but there are other many non-pharmacological resources, and there are also for this holistic care. I'm going to take a bit now about pain and symptoms management. Pain is a very subjective feeling or sensation. It depends on each person, and it's why it's so important to carry out individualized treatments depending on the feelings that each person has. Effective pain management is integral to patient safety, quality work environment, and ethical nursing practice. Ineffective pain management affects the overall health experience of many patients and their families, and places patients at increased risk for morbidity and mortality. In fact, inadequate pain relief hastens death by increasing physiological stress, decrease in monocompetence and mobility, worsening proclivities toward pneumonia and thromboembolism, and increasing work of breathing and myocardial oxygen requirements. Who needs palliative care? So, the WHO says, the WHO is the World Health Organization, says that palliative care is a resource for anyone living with serious illness. The majority of adults in need of palliative care have chronic diseases, such as cardiovascular diseases, 39%, cancer, 34%, chronic respiratory diseases, 10%, and diabetes, almost 5%. Many other conditions may require palliative care, including kidney failure, chronic liver disease, multiple sclerosis, Parkinson's disease, rheumatoid arthritis, neurological disease, dementia, congenital anomalies, and drug-resistant tuberculosis. Pain and difficulty in breathing are two of the most frequent and serious symptoms experienced by patients in need of palliative care. For example, 80% of patients with cancer and 67% of patients with cardiovascular disease or chronic obstructive pulmonary disease will experience moderate to severe pain at the end of their lives. In this, opioids are essential for managing pain and can also be used to other common distressing physical symptoms, including breathlessness. Controlling such symptoms at an early stage in an ethical duty to relieve suffering and to respect the person's dignity. This table describes all the recommendations related to analgesia for cancer pain and other recommendations about medicine. I think it's very interesting, and it's very interesting to remark that patients may be started on a combination of paracetamol and another pain opioids, such as oral morphine. And also, you can read all this table. I think it's very useful to know about the medication and painkillers for these patients. Here, these two pictures show us the analgesic ladder in adults. You can see 3 or 4 steps, and also in the left picture, it describes the medication we can choose. So there are different medication. There is different medications here: non-opioids, weak opioids, strong opioids, and adjuvants. Some advice, if you are not used to administer this medication, is move on safety. I want to tell you that because just follow important safety barriers such as double check and thinking about patients' necessities, communicate to your colleagues, ask for help, be human. Something crucial is to understand that being a human also means to make mistakes. But we have the chance to communicate the mistakes without finishing, because we all have the opportunity to change our culture around human mistakes and also improve as a person and as a professional. Finally, I want to explain you a bit about the ethical principles. The ethical principles universally recognized are autonomy, beneficence, non-maleficence, and justice. These 4 principles are common in Western and Eastern cultures, but their application and weight may differ. At the end of life, the priority of making decisions belongs to the patient. If the patient has lost the ability to make decisions, then the decisions are made according to the patient's advance directives, also known as AD, if there is any. End-of-life documents or advance directives help ensure the healthcare wishes and are carried out as you near death and after you die. They are also used if you are incapacitated, meaning you are unable to tend to matter regarding your own well-being. This document must always be attached to the patient's medical history and can be found through access to health information software. The proximate health care is second in decision making on behalf of the patient. If there is no AD or proxy, the decision making is up to the family members. If family members avoid making decisions, then the health care team must make a decision. But what are the studies have shown about palliative care? Studies have shown that palliative care results in improved quality of life with less acute health care use and in mm, moderately lower symptom burden compared to routine care. A meta-analysis on hospice care have also shown that hospice care increase the quality of life uh, and life expectancy for terminal ill patients. Therefore, healthcare providers who will care for terminal patients must have primary palliative care skills. In addition, for all patients to benefit, hospice care must be covered by health insurance in all countries. I decided to put this book by Kubler-Ross. Kubler-Ross was like psychiatry doctor and challenged the traditional clinical approach to death and dying and focus on helping patients and the medical providers accept the inability of the pacing with dignity and compassion. And she was all her life dedicated to palliative care. And she has a lot of books, and I think it's very interesting to read some of them. Here, I attach also this picture, and it shows you a lot of different associations and also centers that they are here in Norway. So you can, if you are interested, you can have a look at that. Also, I attach here some references. And finally, thank you very much for your attention. See you. If you have any question or any suggestion, you can contact me by email. Thank you very much. Have a nice day.